Many people who are professional drivers or pilots or captains have sleep problems. It's really important to notice that they have sleep problems and treat them effectively. If you're a professional driver or pilot or captain and you have a sleep problem, you can still do what you're doing, but we have to document and understand that you're really being treated effectively. The Department of Transportation has really realized this recently and are really creating more and more rules. Recent demographic studies have shown that a third of CDL truck drivers have sleep apnea, and most do not know that they have it. Increasing scrutiny is really helping correct these problems and make our roadways safer. There's some new recommendations from the Department of Transportation for physical exams and evaluations. It appears that most people with DOT certification will need to be screened for sleep disorders and have appropriate treatment of any sleep disorder found to continue driving and certification. You can maintain your DOT certification if we find these and treat them effectively. If you have any sleepiness or fatigue, you will need to discuss sleep testing with your DOT physician or your private physician. Even if you have no symptoms, there are some risk factors that the Department of Transportation makes us screen people for. These risk factors are a neck circumference of more than 17 inches in men and more than 15 inches in women, a body mass index of more than 35. You can go to our other section on expertsleep.com to look up BMI or body mass index to calculate your body mass index. There's an increased incidence of sleep apnea as body mass index goes up. If you're on two medicines for hypertension, there's a higher risk of a sleep disorder called sleep apnea. So when you have these, you're going to need to be screened for sleep apnea. If you have it, we need to treat you effectively and prove that you're on treatment. Now, some companies require that all their drivers, pilots, and captains be tested for sleep apnea to maintain their certification and to maintain employment. If your company does this, we'd advise you to get testing before they require it and get treatment on your terms rather than someone else's terms. The most common sleep disorders that affect the population and drivers are sleep deprivation. Sleep deprivation is not getting enough sleep, so we all need 7 hours of sleep every night. Shift work syndrome is also very common. This is defined as people who are working when their brain would rather be asleep. So we need to align a circadian rhythm to improve their circadian rhythm and make their workday correspond with the time that their brain wants to be awake. Sleep apnea is very common in truck drivers, pilots, and captains, and many of us as adults. And another large problem is called insomnia. Insomnia can really make it so you can't sleep and then you get sleep deprived. All of these are very treatable, and we just need to identify and help you treat them. Untreated sleep disorders cause poor brain function, poor decisions, and worse response time. They increase accidents, deaths, and liability. Untreated sleep disorder causes worse health and makes it so you don't live as long. Untreated sleep disorder causes increase in obesity, hypertension, diabetes, cholesterol problems, cardiovascular disease, heart attacks, and strokes. And now some sleep disorders have been shown to have a higher incidence of cancers. So we sure want to identify these and get them treated. When we treat sleep disorders effectively, we know that we improve health, performance, we decrease accidents, and we decrease overall healthcare costs because people don't have as many health issues. To undertake some more testing, please go to expertsleep.com and fill out our Expert Sleep quiz and present this to your physician. I'm sure that they'll look through it with you, and if you need testing, you can get testing. Thank you.